Vanakkam, good morning. In this video we are going to discuss about the ventricular muscle action potential. This is the important topic from the cardiovascular physiology. The ionic basis of the ventricular muscle action potential is the most frequently asked university question. The ventricular muscle action potential is the fast response action potential, type of fast response action potential. Fast response action potential also produced from the atrial muscles and Purkinje fibers. So fast response action potential seen in the ventricular muscles, atrial muscles and Purkinje fibers. This is the fast response action potential. So ventricular muscle produce the fast response action potential. It has the four phases 0, 1, 2, 3. The resting membrane potential of the ventricular muscle is the minus 90 millivolts. The action potential duration is around 300 milliseconds, the longest duration compared to the nerve and muscle. Nerve and muscles, the duration of the action potential is the 1 or 2 milliseconds. Here 300 milliseconds. So four phases 0, 1, 2, 3. First phase 0. Phase 0 is called as the depolarization phase, from the resting membrane potential to the depolarizations, rapid depolarization and overshoot. It is reaching up to the 20 millivolt, minus 90 millivolt to the 20 millivolts. So it's overshoot. It is mainly due to the sodium influx. Sodium influx produce the rapid depolarization and overshoot. Due to the opening of the voltage scattered sodium channels, produce the phase 0 of the ventricular muscle action potential. Phase 1 of the ventricular muscle action potential, it is mainly due to the sudden closure of the voltage scattered sodium channels. The phase 1 is called as the initial rapid repolarization. Initial rapid repolarization. It is mainly due to the sudden closure of the sodium channels and potassium efflux. Potassium is moving outside from the ventricular muscle cell. Potassium efflux. It is the potassium efflux is mainly due to the outward transient rectifying potassium channel opening of the outward transient rectifying potassium channel. So phase 1 is mainly due to the sudden closure of the sodium channel, voltage scattered sodium channel and potassium efflux. Phase 0 is mainly due to the sodium influx due to the opening of the voltage scattered sodium channel. Phase 2 of ventricular muscle action potential. This is the phase 2. This phase is called as the flative phase. It is maintaining the flative state. So flative phase, it is mainly due to the calcium influx. Calcium enter into the ventricular muscle cell. Calcium enter into the ventricular muscle cell through the L type of the calcium channel. L type is the long lasting calcium channel. Opening of the long lasting calcium channel produce the flative phase of the ventricular muscle action potential. Okay. So phase 3 is the potassium. Phase 3 is called as the final repolarization. It is due to the potassium efflux. The potassium is moving out through the outward delayed rectifying potassium channel. It is due to the potassium leaving outside the cell through the outward delayed rectifying potassium channel. Phase 4, this area is the phase 4 towards a resting state. It is mainly due to the potassium efflux. Phase 4 is mainly due to the potassium efflux. The potassium efflux occurs through the inward rectifying potassium channel. So inward rectifying potassium channel make the potassium efflux. Summary of the ventricular muscle action potential. Phase 0 is the depolarization, rapid depolarization and overshoot. It is mainly due to the sodium influx, opening of the voltage gated sodium channels. Phase 1 is initial rapid repolarization. It is due to the closure of the voltage gated sodium channels and opening of the potassium channel, potassium efflux. Closure of the sodium channel and potassium efflux. Phase 2 is the flatty phase. It is due to the calcium influx. Long lasting type of calcium channel opening causes the calcium influx. Phase 3 is the final repolarization phase. It is due to the potassium efflux. Final phase 4 towards the resting state. It is also occurs due to the potassium efflux. Thank you for watching this video. If you like this video, share your friends. Those who are not subscribed this channel, please subscribe. Thank you once again.